Good morning, judges. I am Jing. Today, I would like to introduce my project, CareLink, a smart reminder and guardian coordinate system for elderly care. According to the United States report, between 2020 and 2050, the proportion of the global population aged 60 and above will increase from 12% to 32%. In simple terms, the number of elderly people worldwide is growing very rapidly. By 2050, the global population aged 60 and over is expected to reach around 2.1 billion, and the number of people aged 80 and above will increase to 426 million. This demographic highlight a serious trend for the society, especially in terms of healthcare, safety, and daily support for elderly people. So our first project statement is to the risk to the elderly people living alone. Firstly, elderly people who live alone face significant higher risk compared to those living with a family member. Some of the research also show that the elderly individual living alone are more likely to experience chronic disease, suddenly death issue, and accident fall. Due to memory decline, they may forget to take the medication, miss appointment, or fail to respond quickly during the emergency. Additionally, many elderly people living alone face emotion and social challenges such as loneliness, lack of companionship, and difficulty in accessing medical care. And the last one of the problem statement is care process breakdown due to the family structural change. In many Asian society, elderly parents were traditionally cared by their children in multi-generation household. As a result, many elderly parents are living alone, especially in rural areas, without consistent physical, emotional, or medical support. This situation creates a serious care gap where the daily need, health condition, and emergency may go unnoticed. Based on this problem, our project aims to achieve the following objective. Firstly, to enhance the safety of elderly users by providing real-time fault detection and immediate alert notification to caregiver and family member. Secondly, to design a care recipient mobile application with large font, simplified navigation, and easy authentication process, making it more comfortable and accessible for elderly users. Thirdly, to develop a scalable system architecture that supports the integration of IoT devices such as wearable watch and monitoring device and allow for the future health monitoring feature and external service. My final year project also align with the several United Nations Sustainable Development Goal. The first one is the number 3, good health and well-being. CareLink support elderly health by providing medication and appointment reminder, fall detection and real-time alert. This feature help prevent medical emergency and encourage proactive health management. Secondly is the number 9, industry innovation and infrastructure. It combines AI and IoT to create a scalable solution to overcome the caregiver challenge. And the last one of SDG is the number 11, sustainable city and community. CareLink support the elderly individual to live safely and independent at home. This reduce reliance on institution care and help build inclusive, resilient, and sustainable community. Let's go with the system demonstration. Firstly, I will explain the authentication function of the CareLink application. Before the user using the CareLink application, the registration process is needed. Function allow the new user to create an account in a guided and structured manner. The system is designed to reduce the complexity and ensure all the information is collected correctly. During the registration process, caregiver can create their own account and register care recipient by entering care recipient information. This includes basic details such as name, age, and health condition, which are important for personalized care and monitoring. Additional to standard login, the system also supports biometric authentication on supported device. This feature helps elderly users log in more convenient without needing to remember complex passwords. Next is the fall detection module is designed to protect care recipient users who live alone by automatically detect fall incident and trigger immediate alert. This feature uses data collected from wearable device to monitor motion pattern and sudden change in movement. When the system detects abnormal motion and match the fall pattern, it will automatically classify the event as a potential fall. Once fall is detected, the system immediately sends real-time alert notification and emergency call to caregiver through the CareLink application. This allows caregiver to respond quickly even if the care recipient is unable to call for help. The system also includes a confirmation mechanism. Overall, the fall detection feature significantly improves the care recipient safety and emergency response efficiency, helping to reduce the risk of severe injury or delay medical assistance. The caring system provides a comprehensive medication reminder function. Doctor or caregiver can set up medication schedule throughout the system, including the details such as medication name, dosage frequency, and prescription time. The reminder interface is designed to be user-friendly, using large font, high contrast color, and simple instruction. This helps care recipient easily understand what medication to take. Receiving the reminder, the care recipient can confirm that the medication has been taken by tapping a simple confirmation button in the application. That's all my planning application presentation. Thank you.